Hello, my name is Patrick+Ryan. This is Public Health in Urban Areas. There are two main reasons that public health in urban areas is of concern. One being large number of persons involved, and two being the fact that public health changes when the population density becomes so great. Issues include prevalence of crime and violence, which lead to physical injury, increased sexual encounters, which lead to increased sexually transmitted diseases, and a large socioeconomic difference, which leads to a divide in public health. More issues include high psychological stressors, which can lead to illness, lack of outdoor areas for physical fitness, and low air quality, which can lead to respiratory illness such as asthma. Sanitation, water, and electricity availability become an issue in high urban areas. This leads to infectious disease, also lack of health insurance, which leads to poor care, poor access, and a divide in healthcare, which creates a burden on the economic system. According to current data, higher populations experience poorer quality of health. This is a website showing my hometown, which is considered highly urban because the population is more than 100,000. This shows that every aspect of social and economic, physical, and health factors are poorer. One of the main causes of these health issues is the population size. In Manhattan, there are 52,000 people per square mile. In contrast, the overall United States population density is at 70.3 people per square mile. With increased contact, you get increased proximity of transmitting communicable diseases, which causes public health issues. The main cause of public health issues is the socioeconomic divide. People with lower income can only gain access to lower income based medical care. They can only gain access to reduced priced housing, and this can lead to violent crimes, including robberies and dealing of illegal drugs. Government policies can also cause public health issues. The waste disposal programs and land use policies for food and water are showing signs of failure. One of the main signs of failure in government policies is setting up low-income housing. This low-income housing is used for people to live in, but it ends up getting run down, and there's no more funding to renew the housing, so it ends up being abandoned, and the government just ends up tearing down the housing projects. I think healthcare reform is the only way to increase public health for the better. With more than 50 million people uninsured, more than 50% living in urban environments, 31% relied on government health care. And of those 31%, the top three groups are illegal immigrants, people aged 19 to 25. I think we should get rid of the Affordable Care Act, which requires everyone to have health insurance even if you don't need it, increases economic strain on the government, and also increases the reliance of the poor on the government. I think we should tax those who practice bad health practices like smoking and people who are obese. Higher taxes on obese practices, which I call obese taxes, include higher taxes for all-you-can-eat buffets and also higher taxes on junk food like candies and snacks. I think we should also subsidize good health practices like exercising and subsidize healthy foods, which will encourage exercising and also good health. Thank you.